How mindfulness affects attention is the focus of many recent studies, including this one by Amishi Jha at the University of Pennsylvania. It is particularly important as it offered an 8-week class in MBSR, mindfulness-based stress reduction, to a group completely naive to mindfulness meditation, and compared it to both controls and experienced meditators. Not surprisingly, at time 1, prior to the intervention, experienced meditators who were entering into a 1-month silent mindfulness meditation retreat revealed improved conflict monitoring over controls in the intervention group. At time 2, after the 8-week course, MBSR participants significantly improved orienting, the ability to quickly and accurately move and focus attention. At time 2, both groups were equally able to perform executive function tasks, well above that of the control group. With this increased capacity to pay attention, not surprisingly, there are accompanying increases in cognitive capacity in those who practice mindfulness meditation. We even see changes in EEG activity, increases in alpha waves associated with focus and attention, gamma waves associated with complex task performance, and a decrease in delta brain waves linked to drowsiness. As we mentioned earlier, the trait of mindfulness is cultivated through intentional attention, which is bathed in a milieu of non-judgment. At its heart, non-judgment arises out of self-compassion. Gentle, honest, and kind acknowledgement rather than harsh, negative self-talk. It honors our common humanity in recognizing that life's difficulties and challenges are inevitable, and that we all make mistakes, even while doing the best that we can. Instead of getting on the treadmill of self-criticism, it allows the awareness of insights and acknowledges pain without rumination or self-blame. Rather than autopilot reactivity, wise, kind responsiveness can then follow. Not only does the practice develop intrapersonal compassion, but interpersonal as well. Those who practice mindfulness meditation are more capable of discerning nuances of emotions in Ekman's facial expressions, a capacity known to be linked to the quality of empathy. Brain imaging studies using functional magnetic resonance imaging have implicated the insula and anterior cingulate cortices in the empathetic response to another's pain. These areas of the brain increase in blood flow and electrical activity with mindfulness meditation. This gives rise to an extraordinary possibility. Perhaps empathy and compassion can actually be learned. Among the skills considered essential to being an effective counselor or caregiver are strategically controlling attention during interactions and having both an intellectual and affective empathetic response to the client. A review of the literature reveals, however, that educators have little empirically based direction on how to cultivate the habits of mind in their students that are necessary for controlling attention and for having an empathetic response. The majority of training literature for psychology, nursing, and medicine focuses on developing those empathetic responses that are external and observable, such as mirroring thoughts or feelings. Some researchers suggest that these educational processes leave much of this development to chance, and that this inattention to the cultivation of internal skills may result not only in decreased efficacy in care, but an increase in the anxiety of the caregiver. cultivation of the innate capacity of mindfulness may meet the need to develop efficacy in these areas of attention and empathy. It has been revealed that mindfulness is a significant predictor of counseling self-efficacy, that attention is a mediator of that relationship, and that mindfulness may be an important variable in the development of key counselor preparation outcomes when studied in psychology counselors. There is a growing literature on how mindful speaking and listening can bring clarity to the clinical narrative experience as well as workplace communication. The same principles that are brought to a personal mindfulness practice can be brought into relationship and communication, a key factor in patient safety and personal and work-related communication. Intentionally paying attention, moment to moment, non-judgmentally. In doing so, we pause, setting an intention to be present, kind, open, and flexible. Releasing what doesn't need to be held, for example, muscle tension. Even now, check in with your own shoulders and see what you notice. Releasing opinions and fixed ways of thinking or reacting. Listening deeply, letting go of preparing a response while another is speaking and we are listening. Noticing and releasing the urge to give advice or an opinion. Simply listening open-heartedly. We speak the truth of the present moment rather than a fixed, reactive reply. And are open to outcome, letting go of needing to steer the conversation in a particular direction. Each communication then fresh, alive, unique, and mindfully responsive. These building blocks of mindfulness allow a growing trust in one's capacity to be with life, whatever it brings. Accepting things as they actually are in the present moment. This is the antithesis of the suffering that arises in wanting life to be different than it is. Jon Kabat-Zinn says, mindfulness is cultivated by assuming the stance of an impartial witness to your own experience. Opening our own kind hearts to life just as it is. We develop patience, understanding, and acceptance of the fact that things unfold in their own time. We give ourselves room to really be here for our life. And why not? Life is already here, just as it is. We might as well be here for it. Studies to date in nursing education and nursing populations are small. Despite this, the authors, Joanna Cohen-Katz and Shauna Shapiro, conclude that in its emphasis on self-care, compassion, and healing, mindfulness meditation practice is relevant as an intervention for helping nurses manage stress and reduce burnout. Randomized controlled studies in medical and pre-medical student populations have similar findings, with decreases in depression and anxiety and increases in empathy. And mindfulness is cultivated through experiential rather than cognitive learning. So perhaps this moment is the time to begin.